In this video, we'll discuss about ECG changes in hypokalemia. Hypokalemia is defined as serum potassium less than 3.5 milliequivalent per liter, and moderate hypokalemia is usually defined as serum potassium between 2.5 to 3 milliequivalent per liter, and severe hypokalemia is defined as serum potassium less than 2.5 milliequivalent per liter. So we need to understand about the hypokalemia and the ECG changes in the hypokalemia because it's a potentially life-threatening electrolyte imbalance. So these are the ECG changes that can occur in the hypokalemia. So the initial ECG change that occurs in hypokalemia is the decrease in the T wave amplitude. This is a very important change in the ECG in hypokalemia because this is the initial finding. So followed by this finding, the other findings can occur. Like the other findings include T wave inversion, and this can be followed by the presence of the ST depression, and you will be able to appreciate U waves in the hypokalemia. This U wave occurs because of the prolonged repolarization, and it is usually it occurs after the T wave. And similarly, in addition to those four findings, there can be other findings like increase in the amplitude of the P waves and the prolonged PR intervals. So here you can see this is a normal ECG, and this ECG which is shown in the lower side is the ECG of a patient with hypokalemia. In this ECG you can see that the T waves amplitude is decreased in comparison to the normal T wave, and similarly you can see the presence of the U wave after the T wave. So this U wave is one of very important findings in a patients with hypokalemia. So now we'll discuss about these changes by looking at the 5 ECG examples from patients with hypokalemia. So let's begin. So this is the first ECG of a patient with hypokalemia. Here you can see that there is obvious T wave inversions in the many ECG leads, and this is followed by the presence of the prominent U wave. You can see the prominent U wave in the many leads. Similarly, you can also see that there's a prolonged PR interval in this lead, and if you look closely, you can see that the P waves are a little bit prominent in this EKG. So in addition to this, you can also see this ST depression which is present in the many ECG leads. So these are all the findings suggestive of the hypokalemia, and we need to understand all these findings, and we should remember all these findings to understand the ECG changes in hypokalemia. So now moving on to the second ECG. In this ECG you can see that T waves are flattened in almost all the leads. Like in this lead 1, T wave is very flat. Similarly in the lead 2, lead 3, as well as in the chest leads as well. Like you can see in the V5, V6, T wave is very flat. In addition to that, you can see the prominent U wave in lead V2 as well as in lead V3, and as well as in the V4 you can see some U wave. Okay, these are the findings of hypokalemia. Now moving on to the third ECG. Again, this ECG shows the same findings. Like you can see U wave in V2, V3, and there's a flattening of the T waves almost in all the ECG leads. There is a ST depression in lead 2, lead 1, as well as AVL in other leads, and you can see the T wave inversions as well. It's shown in this V6 lead. So the next ECG change in hypokalemia is apparent prolongation of the QT interval. Actually, the QT interval is normal in hypokalemia, but because this T wave and U waves they usually merge, and when we calculate the Q wave, when we calculate the QT interval, we tend to be confused because of the presence of the U wave. So QT interval looks as if it's prolonged, but actually it's normal. So it's known as a pseudo-prolonged QT interval or apparent QT prolongation. So we need to be very careful while interpreting the QT changes in patients with hypokalemia. Here you can see the normal ECG with the normal QT interval and the normal corrected QT interval. So this fifth ECG is the first ECG we have discussed, but I kept it here so that we can do help you memorize the ECG changes in hypokalemia using a simple term push down effect. This mnemonic is very important because if you remember this one term push down effect, you can easily understand that the T wave and ST segments are usually pushed down in hypokalemia. Like usually there's a T wave is flattened or inversion because it's pushed down. Similarly, ST depression occurs because it's also pushed down. And when ST segment and T waves are pushed down, there will be the prominence of the U wave. So if you remember this phrase pushed down, you will easily remember the major ECG changes in the hypokalemia. Similarly, in our channel, we have ECG changes in the hyperkalemia related video, so you can go through that video and make yourself familiar with the hyperkalemia. So I'll keep the link in the description. So I hope this video was helpful. If this video was helpful, please share it with your friends and please leave some comments. Thank you so much for watching. Subscribe to our channel for more videos.